Hey Julian, it's Jenna.
Brennan.
And today we're going to be doing our assignment on the toolbox. So the first item that we chose to put in our toolbox is a phone. And we use this to represent the nurse-client relationship, which is one of the CNO standards. So when working on the unit, there are phones that the nurses are able to have on them so that when one of their patients pushes a call bell, we can be there. The phone also represents an open line of communication for the patient and the nurse. We as future nurses need to learn to be understanding and always willing to listen and support our patients.
Next on the list is our black lab bag. So the black lab bag was great when we started the program. This was loaded with a whole bunch of stuff that we'd be using in our labs. So it helps us gain a set of skills related to nursing, such as the controlled acts. And these help us in our CNO entry to practice competencies. We need to be prepared to use these acts, controlled acts, when dealing with patients. And such things would be catheters, intramuscular injections for medication administration, same with subcutaneous, IV lines, sterile technique, wound dressing. All of these skills we learn throughout our course of our program, not just through athletic healing hearts, but also health assessment, our med-surg courses, and sim lab and open lab. And once we have these skills down, we can pass tests and we can use them and confidently and competently be able to use them in our nursing field with our entry to practice.
So the next item that we chose to have in our toolbox is a lock, and we're using that to represent the CNO standard confidentiality and privacy. So there are many different ways that we can protect our patients' confidential information. If we have any proper documents with patient personal information, it is important that once we are finished with it, we properly dispose of it. Another big thing to be aware of when it comes to confidentiality and privacy is when you are talking about a patient's situation. You have to be aware of who is around you listening to the conversation and also decide whether or not the person you are talking to is actually involved in the circle of care.
Next on the list, we have hats. So hats are unique because they help us represent what role that the nurse is going to be in. So throughout the nursing career and related to College of Nurses ethics, practice standard, when in nursing, we're going to be put in situations where we need to be in different roles depending on what situation is occurring. And we have to be able to put our own biases and opinions aside because the patient has the right to choose which plan of care that they want or to right to refuse medications. That might be not something that we would agree with, but we need to respect that and be able to step into that role of the ethics situation and be okay with it. Just making sure that we're there for the patient. So no matter young or old, palliative or not, we have to be there for that patient. Next we have our drug book. So this is going to come very handy to have in our little toolbox, and that's because a drug book is filled with all of the medications that we'll be using. Medications can be dangerous, and it's up to us as nurses to monitor the patients to ensure that we have safe ranges of medications before administering them, but also have knowledge of the side effects, the dosage, mixability, and other names. So this book will give us all that information, and we can always resort back to it as necessary. When reading through the drug books, so this is also very important for new graduate nurses because we can use it as a reference when we are unsure on the floor that we're on of what medication our patients will be using.
So the next item we have is a name tag. So we use this to represent the professionalism, which is also one of the CNO standards. As a future nurse, we need to ensure that when we come to work, we are being professional. We need to ensure that we are wearing appropriate attire, and as a future female nurse with long hair, this will mean that I will have to ensure that my hair is up and out of the way. For male nurses, they will need to ensure that if they have facial hair, it is kept trimmed or shaved right off. The next one that we have chosen, item that we have, is a pen. And this is to represent the need to be prepared. So it is important that when we are on shift, we are ready and prepared for anything that may happen. We need to take the responsibility to come in earlier than the minute of our shift beginning so that we can get report from the nurse who was on the shift prior to us and be able to find out anything extra that our patient may need.
Next, we have the reflective journal. So the reflective journal, and this also goes with our learning plans, this is very good because it actually relates to the CNO quality assurance program. So the reflective journals we use to reflect on our practice during the week that we are at placement, and we can learn from it. We can relate it to theory. Now, relating the practice to theory is really good for us because we'll have better understanding of why things are occurring and what ways we can go about them. So this, and again, with the CNO Quality Assurance Program, they will also ask us to do something related to our reflective journal. So this also is preparing us for when that occurs. And we need to be competent and use this reflection on our practice to make sure we are learning from it and be prepared for future. And it explains that the nurse would be prepared for certain situations. Next, we have the Jarvis Health Assessment book. Now, this is the mini book. There's also a large one, but the mini book is good to keep in our toolbox because we can use this as a resource. We can just pull it out and flip through a couple pages. The purpose of this one and why it's important is because it ensures that we have the resources to look back on, but also we can use it to find out if something we're seeing, feeling, or hearing isn't the right way or something that we're used to. We can look back on this to find out what is occurring or what sort of thing is happening so we can document it properly and report it off to the physician or the next nurse coming on. When dealing with different types of patients and being a new nurse graduate, you're not going to have a lot of experience yet at this point, especially if you're so used to one floor and then jumping into another one. There's going to be certain patients that you're not used to hearing or feeling or seeing. So again, having this book is great to resort back to that. And it's also good for experienced nurses, again, who might have a floor change or a different type of patient and they're used to one set of way of assessments. This is a good resource for them. And this book is also good to keep in, not necessarily for the hospital, but if you ever get into community nursing, it may be one of the only resources that you can quickly pull out and find, okay, I need to do an assessment on this because leading up with what findings that you had previously.
So the final object that we chose to put into our toolbox is a ball. So we chose to have this item in there to represent being a team player. When working as a nurse, you're in a team setting, so you will need to be able to work well and support each other. Being part of a team requires you to be able to not only take the lead, but also be able to follow direction. For example, helping cover patients when a nurse goes on break and establishing good communication with your fellow nurses so that your patients have the best care possible.
That's it. That's all 10. There you go. Thanks.